The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of minimally invasive facial rejuvenation. With us, we have an expert on the topic, Dr. Petro. Dr. Petro, welcome to the program.
Thank you.
Now, before we get into today's topic, tell us a little bit about your center. We should mention you are a board-certified head and neck surgeon, also a cosmetic surgeon as well, did a fellowship. Tell us, you have Petro Cosmetic Surgery Center, and then you have the Tivoli Medical Spa. So tell me about those.
Well, the medical spa is more for people that come in that want to peel or microdermabrasion. Basically, they're unhappy with their skin. It tends to be younger people, but can also be older people. Sometimes the skin tone is uneven. People, as we age, our pores start to get larger, start to get fine lines, and a lot of those things can be treated with minimally invasive things such as lasers, intense pulse light, sometimes even laser resurfacing.
Okay.
We do hair removal for unwanted facial hair or body hair.
What's the hottest procedure, by the way, that women 35 plus, 40 plus are getting right now?
Probably Botox.
Botox, okay.
Botox, if you get it every 3 months, you tend to be able to stretch it out. Also, I mean, it tends to help preserve you. So if you notice older people, some people just have a big line down their forehead, and Botox wouldn't treat that. But if you start,
you have Botox?
I do have Botox.
All right, okay. So you swear by, you love Botox?
I do my own.
All right, you do your own Botox. Interesting. Okay, so now in the area of lasers and things like that, what type of problems do you treat or are you using those for?
We treat pores, we treat fine lines, hair, any kind of excess hair. Also, people that have sun damage or sunspots, which is really popular, especially as we age. Makes your makeup not go on as smooth when you've got differences in texture on your skin. So the laser is really good for skin texture.
Now you have pictures of some of your facelift patients, and they really are good. And again, for people watching this is a real interview. Nothing is rehearsed here. I'm trying not to endorse you, but those are some of the best I've ever seen. So we're gonna talk about those in a little while. But first, let's talk about the little things like lips. Hot topic. I know you have a picture of lips.
One of the biggest complaints with lips is, especially women as they start to get in their 30s or 40s, tend to get vertical lines in the lips. And one of the biggest things is the lipstick tends to go up into those lines, so they can put their lipstick on and can't hold it in place. And so adding just a little bit of volume to try to help keep the lipstick from going into the lines is big. People are afraid of looking like some of the movie stars that we all know of that have big lips. I don't like big lips.
Yeah, I don't think anybody likes those big, giant, fake lips.
One of the first things I tell patients is my lips are real, and I've never liked
those are real.
They're real, and
yeah.
But I'm not a fan of big lips.
Now, you told me something very funny. They say, I don't want my lips like yours.
Right. I always let people know that as well.
So there's a lot of art in that, a lot of technique in that?
It's all an art. I mean, if you look at someone's face, I can't help but think of how they could look or what it is I want.
Is that right? I mean, when you're out and about and you look at a woman in her 40s and you're going, boy, small things, I could make a big difference. I mean, does that go through your head, really?
It does. It's just part of, it's an artsy thing. I mean, it's, you look at people and you want to design them the way that you know they could look best. And it's what drew me to this profession. It's what keeps me there every day. It's what makes me love what I do.
A little bag under my eye, you say that what would be good for me on that?
You do have some bags under your eyes, which can tend to make you look tired. And the left side of your cheek is a little flatter than the right, so sometimes adding volume.
You put fillers in there?
I do.
Okay.
Fillers help a lot in the cheeks. It adds volume. Everybody wants to be thin. Everybody wants to be a certain weight, but when you get there, a lot of times the face tends to suffer, and you tend to look thin and gaunt in the face, which is not considered attractive. So adding volume in the face is a big thing, and over time we lose volume. We lose volume in our lips. We lose volume in our cheeks. What used to be here tends to end up here. So a very youthful look is having healthy cheeks.
Okay.
So we try to put that back.
So back to lips, that photo. What are we looking at there?
This is a picture of a lady whose main complaint was that her lipstick bled. She didn't want big lips. She didn't want to look unnatural. So when you look at the first picture, you can tell that she's got some fine lines, vertical lines up her lips. And so by adding volume to the lip itself, those lines soften significantly.
It goes away. Very nice.
The other thing that happens is a lot of doctors tend to fill the filtral columns, and when you fill them directly,
you mean the lines, the actual lines? Okay.
They tend to look more pronounced. So there's a way of kind of crisscrossing the filler that helps it soften. It's all about softening and looking natural.
Is that your goal, by the way? I mean, when you see those big lips out there, do you think that was in the patient told the doctor, this is what I want? Do you think it was the doctor that said, this is what looks good to them? What are your thoughts there?
It's very rare for a patient to come in and say, this is how I want to look. For the most part, patients come in and they say, my cheeks look hollow, or my lips aren't as full as they used to be, or my lipstick ends up at my nose before the end of the day. What can I do about it? What do you think? And my role is to let them know what I think, honestly, not without trying to sell them too much product or have them put too much product in their lips. The lips that you see that look unnatural, I mean, that took a lot of product. I do spend a lot of time telling patients there is no way that one vial of this can cause you to have unnatural large lips. It's not possible.
All right. Now what about this photo right here?
This is a younger girl who wanted slightly bigger lips. I mean, that's actually an example of fat grafting, which is a more permanent solution than fillers. It can still be done very easily in the office, but that's an example of fat grafting. But she just wanted larger lips. Here's another patient who her only complaint, she was actually very hesitant to have any filler in her lips. Her only complaint was her lipstick running, which again is very common. So that's just a little bit to try to keep her lipstick in place. And
so by plumping up the lip, it keeps their
lipstick in place, keeps it from running into the
running where? Into their mouth or
up their lip?
Is that right?
Their upper lip. That's a very common thing, and a lot of times women feel like they look like they were smokers, although they never were. Because people tend to call those smokers' lines, and they're not necessarily. It's genetic. You either get them or you don't. So.
All right. Now let's start with the eyes. Okay, so you're in an evaluation. Somebody comes in. What do you do for the eyes? And tell me about the aging eyes.
Well, over time, as eyes age, especially the lower eyelid tends to be first in most people. Again, that's genetic. So over time, that fat can start to poof out. And so one treatment for that is a blepharoplasty, in which we take the fat and either reposition it or remove small parts of it.
And this is under the eye?
Under the eye.
For the fatty bag stuff?
Right.
Okay.
And that's really, the other option is a chemical peel or resurfacing if the problem is more the skin, if there are fine lines around in the skin under the eye. Another option is Botox if it's the crow's feet or the lines out to the side. Botox very effectively treats those lines.
Okay. Now for the hollowness though, the bag under the eye, what do you do? Because I mean, I talk to certain doctors. Certain doctors say, well, you don't want to fill that area. Doesn't really work well. Maybe you want to do an upper facelift, or tell me about your thoughts.
It depends on your perspective. Now, I used to have a bag, a deepening under my eye, and I used to get that filled. Well, that's a very difficult area to fill, and the skin is very thin. So just a little too much creates a bump that's visible for quite some time. Having had that, I'm not one to fill under the eye. A lot of times the problem is this is all one subunit, the lower eyelid and the midface. So sometimes just raising with a mini facelift, just raising this skin back up where it was will fill that perfectly.
And what about incisions? I mean, where do you place those?
They're hidden in the hairline and then behind the ear.
And what do you call that, by the way? Is that
I call it a mini facelift.
Mini facelift, and that's really to just take care of?
The lower eyelid and the midface are really one.
Okay.
It's hard, you can't really separate them. They're one subunit, and you want them to flow. You don't want them to look separate.
Do you think, I mean, when people go to somebody, medical spas in every corner that are only doing fillers, I mean, do you think that they should go to somebody that does a facelift or somebody that does both to get a fair evaluation? What are your thoughts on that?
I tell people that often. I think that saying that if you're a hammer, everything looks like a nail, it's true. If you go to someone that only does fillers and you have a problem, chances are overwhelming you're going to get a filler.
Okay.
If you go to a surgeon, chances are overwhelming you're going to get surgery. I think doing both gives me an advantage, because if I think I can treat someone with a filler and avoid them having to have a surgery, that's what I'm going to do. I mean, everything's a ladder. The least invasive is always the best. There's risk with everything you do.
Okay, what about implants under the eye for bags?
Well, they help. They can certainly help mask the problem. There's no question about it. And sometimes they treat it. If the problem is where you have a deficiency here and you replace it, then it can actually help treat it.
Okay, let's talk about that skin under or above the eye.
There are a couple of things with the skin above the eye. A lot of times it's treated as if it's just this skin, and often it's the brow. So the first thing to do, and the first thing I do, is check the brow position. And you want to make sure the brow is in the right position. If the brow is too low, no matter what you do with the skin, it's not going to matter. if it truly is the skin or if it's both, an incision can be hidden right in the crease of the eye. And you take just a little bit of skin out, just enough. You don't want people to end up with an eye that's open or an eye that won't close. And that can certainly happen with over-aggressive skin removal.
Okay.
So you want to create a very natural look, and you certainly want the incision to be hidden in the crease of the eye.
But the brows, too high, I guess it becomes very obvious. Could make a woman look older.
It's really
So what do you do? I
unattractive.
mean, how do you decide how high the brows go?
Well, there are things that have been decided years and years ago as far as what looks the best. For a man, it should be right along the supraorbital ridge. For a woman, it should be there or a little bit higher than that. Now, a lot of times it seems that brow lifts are overdone because now we have other options. We have Botox, which can treat and actually raise the brow by chemically weakening the muscles that bring the brow down.
Can you really lift it up a
You
little bit
can.
though? Really?
Definitely
With
lift it up.
Botox? Okay.
Absolutely. That's the best option because you avoid an incision, and if it works for you, then it's a really good option. That's how, I mean, a lot of people keep their brows raised. That's what I do, to keep my brows where I want them. So it's a really good option. It doesn't work forever, but it certainly works. It works for a while.
Okay, now neck and jowls.
The neck is just a giveaway sign. When your neck starts to drop, I mean, people inject Botox into it. People do all kinds of things. They do lasers to try to tighten the skin. That doesn't work. The only thing that really works to help skin, to remove skin, is to actually remove skin.
Okay.
So anytime you have a neck that has sagging skin and someone tells you they can treat it with a laser, I would ask to see their pictures first because it just doesn't work.
So those bands, I mean, what's going on there when you see the...
That's called platysmal banding, but and that can be corrected with surgery. But for the most part, removing the skin or pulling the skin back up where it used to be. People won't turn to the side in pictures. There are men that can't wear ties because of their neck skin.
Because of their neck. So when does somebody know if they're a facelift patient or a surgical patient?
Over time, the skin, you tend to get hills and valleys in your skin, and your cheek skin tends to fall. You start to get deepened folds in your nasolabial or melolabial fold area. Sometimes that can be filled, and that'll actually boost your cheek up just a little bit and sustain you. That tends to happen in the 30s, early 30s to 40s.
Okay.
Over time, that skin just gets to be too much, and if you fill it, you're just going to look puffy.
Okay.
And that's when it's time to actually raise the skin back up. If you really have to take your hand and pull your skin up to alleviate that fold, then filler is not going to treat the problem. As a matter of fact, it's going to make it look worse and make it look unnatural.
But the fear of looking, because the sound of a facelift or even mini facelift sounds pretty dramatic. I mean, is everybody requesting the same thing, just to look natural? I mean, what are they saying? What do they want?
For the most part, people want to look the way they used to look. They have an image in their minds of how they used to be, and they want themselves back. They want to be who they were, especially women. We've had children, we've taken care of everything but ourselves, and there just comes a point where you really want to look the way you used to look.
They want to look pretty.
You forget who you are. You want to look in the mirror and think and love how you look. You don't want to look in the mirror and try to look away as fast as you can.
What do they say on the consult? Okay, so they're going in on a facelift consult or minimally invasive consult. I mean, what do they say to you? I mean, what kind of questions do they ask? Do they mostly just say, "Doc, tell me what you think"?
A lot of times, I mean, for the most part, they've been told they look tired. They've been through significant stress in their lives, and stress tends to certainly helps and facilitates the aging process. Or they've just kind of woken up and they looked in the mirror and realized it's time for them to do something for themselves.
Okay. What are their fears when it comes to the facelift?
I would say looking different is the biggest fear. Nobody wants to look different. And that's where your surgeon comes into play.
Okay.
I mean, you want to look at their pictures, you want to see what they think is attractive, because no matter how much I try or anyone tries to hear and listen, which is probably the most important part of any consult I do, is actually hearing what somebody wants, because that's way more important than what I want. And realizing that is a big step. But for the most part, you want to make sure that what they think is attractive is what you think is attractive.
Is there an education process?
Oh,
like
absolutely.
What makes up an attractive face, things like that?
There is, but it's, beauty's in the eye of the beholder.
Now, you brought some face photos.
I did. Here, this is a good...
Okay.
That's a really good example. This is a lady in her 40s, and if you look, you can see the first signs of aging, which is around the lower mouth and in the jowling area, and her skin started to sag.
You say she's a twin.
She is a twin.
Okay.
So she actually was curious, did she need a chin implant? She'd been told that she did need a chin implant. But if you looked at her, I mean, the chin to me was fine.
All right.
But the neck and the jowls had started to sag, and it was no longer a youthful look. She looked hollow under her eyes. She looked tired. She got told all the time how tired she looked. She ran a very successful, very busy business, and people would ask her, "Don't you just need to take some time off?"
Is that right?
And but she didn't. She just needed a little boost.
So she came in, and is this kind of patient that comes in and said, you know, what do you think, Dr. Petro?
She actually came into me a year before we did her surgery, and she was in a very busy time in her life, and it wasn't a good time for surgery. And as we all know, I mean, there's a time in your life for everything. And she had Botox, and that kind of helped. And we added some fillers and did some various things to get her by until it was a good time for her to actually have the surgery that would correct the problem. And then she came back a year later, and she was ready to have the
So with her, what did you do? I'm looking at the before here. What did you do?
Well, the first thing is her cheek skin. She didn't need a chin implant. She needed the skin to be back where it was, and the malar fat pad had fallen. So the first thing was to reposition that.
So is this a facelift? I mean, so a facelift was...
It is. It's more of a mini facelift.
Okay.
The incision is hidden very well in her sideburn and behind her ear, and then back I hide it in the hairline to take care of the neck skin. But looking at the cheek and her mid-face, that was just put right back where it was, nothing dramatic. And looking at her eyes, she had puffy eyes, and people told her that she looked very tired. People used to ask her, when was the last time you got a good night's sleep? Can you open your eyes? And she never felt like her eyes looked really open. When she put on her eyeshadow, she noticed that she didn't have a crease anymore.
So that upper skin,
so the upper
you had to take care of that, okay.
The upper skin, as well as the puffiness, which is caused by fat herniation. So the upper eyelid was taken care of by removing some skin. The incision's very well hidden, so that you can't see it.
So on the after, it's beautiful. I mean, this is a great, great result. So what do you think you did for her? I mean, she just looks natural. I mean, I always feel like I could spot a facelift walking down the street. Obviously, if you see her...
I hope not one of mine.
Okay. Okay. So what does she say? I mean, is she pleased, thrilled with the result?
She's very, very happy. She feels a lot better about herself. Her business is doing well. Her twin sister...
Yeah, tell me about that. What's going on with the twin sister?
It's funny, because her twin sister definitely wants to have something done, but she told me, I asked her, I said, what are you telling people? Because she said everybody thinks she looks so rested, wants to know where she went, what she did, because she still looks like herself. She just looks like herself 10 years ago. And so she just points out her twin and says that's her before.
Is that right?
So the interesting part about this lady is her and her mother both wanted to have surgery, and they wanted to do it on the same day. But her twin didn't. So she often tells people that, you know, she and her mother can be standing there and they ask if her twin is her mother.
Really? Oh,
So
that's got to be terrible.
It is. It's tough. So even 10 years out, she's going to look younger than her twin, and it's an interesting story to follow because we've got someone that genetically is going to age exactly like her.
Do they ever ask how long it'll last?
They do, and it lasts forever.
So if you follow them out, 10 years from now, the twin that had nothing done will just look older.
Mm-hmm. She should look older. Even though gravity affects us, and over time you may need to tuck up here or there, that you're never going to look the way you would have if you had done nothing.
Okay.
And that's true whether it's skincare that stimulates collagen or laser resurfacing, a full facelift, a mini facelift, lower eyelids, or whatever it is. That's a true statement.
Okay. What other photos do you have?
Let me show you this next patient.
Okay.
This is a lady who, what really bothered her was her neck. Her neck and her cheeks, and she felt like her face looked fat. And she was even interested in trying to do some liposuction on her face.
Okay.
Well, what had happened is the skin, it just was in a position where it didn't belong. It just needed to be put back where it was. She actually agreed to let me show her photos a day afterwards because a huge concern.
So this is the day after?
This is the next day. A big concern of people is how am I going to look the next day? Okay, I know that 2 weeks from then I'm going to be able to do what I want to do, but how am I going to look the next day? And people are scared they're going to look like Halloween the next day, and they don't. And
this is a huge difference.
It's really comforting, and it will get better than that, given that she's got some bruising. But with any kind of facelift, whether it's a mini facelift or not, the biggest complaint is pain in the neck. I mean, they're sore from where they laid on the table. The face doesn't hurt.
So you did the jowls, the neck. Anything for the eyes? Eyes looked pretty good before?
Not with her. She didn't need it, and I think that's a big point because a lot of times people get the full meal deal even if that's not it's not necessarily what they need.
On a facelift consult, by the way, they go in. What do they want to know? I mean, what are their fears? What do they say?
Scared they're going to look different. I'd say that's a really big fear. For the
Or
most,
done. What about that done look?
or the windblown look.
Yeah.
That's big. And it's just a matter of explaining to people exactly how they will look. Pictures are a big part of a consultation for me. If I wanted something done and somebody didn't want to show me their before and after pictures, I would be concerned.
Okay.
So I think being able to show people, because it's aesthetic, I mean, it's art. What looks good to me may not look good to somebody else. What we define as looking good needs to be the same.
Now, do you think, I mean, is there advantage the fact that you have this board certification in head and neck surgery, understanding the anatomy, being able to go deeper or more aggressive? Tell me about that. I mean, what advantage is it there?
I've operated on the face a lot.
Okay.
I mean, there's no question that with the head and neck training, the majority of my training is in the face. It's from here up. So I certainly have a very good understanding of the anatomy there. A lot of parotidectomies and other surgeries that involve the facial nerve, which is a structure you don't want to see in a facelift. And I know where it is. I think that's really important. Okay, here's another patient, going back to the eyes. She looked tired. She looked like she had bags under the eyes.
Just little. It's subtle, though.
It is subtle, but little changes can make the biggest difference. And so by just removing a little bit of the skin and a little bit of the fat and repositioning the fat a little bit, she's got a more natural appearance
Very nice.
from here to there.
So they're gone. And this is called what? I mean, this procedure that you did?
That's a lower eyelid blepharoplasty.
Lower eyelid blepharoplasty. Now, why not just do fillers on this woman? Because it is very subtle. When I look at the before and the after, tell me why.
Well, you can't remove skin with fillers.
Okay.
It's like hemming a curtain without a line.
All right.
You have to remove skin, you have to have an incision. And she needed some skin removed.
Okay.
And by adding fillers, it could have created a really puffy look.
All right.
Not to mention the dangers of adding fillers. A couple of places you don't want to add fillers. One is under the eye, and one is in the glabellar region. So that can be a much more dangerous approach.
Okay.
Vision is an important thing. So.
Yeah, it looks great. Looks very natural.
Okay. Well, let me show you her full picture. This is her full face, and she looks younger, and she looks refreshed.
She did a full facelift on her.
Well, I didn't. That's her full face. I did a mini facelift and her upper and lower eyelids. It's amazing the difference you can make with smaller things. So you can make a big difference in someone and make them look refreshed and relaxed and without doing a whole lot of surgery. And she didn't really have a lot of surgery.
Now, with these people out there that don't like the way they're aging, they're very self-conscious, and you fix it, do you see a huge difference in their self-esteem or in the way they act, their personality when they come on the follow-ups?
Oh, it's amazing. I mean, there are people that didn't wear makeup before, and they come in and they've got their hair done and they've got makeup on. And makeup's a big thing for women. I mean, when you feel good about yourself, you dress up and you take care of yourself. But if you feel like you're just in a hole and nothing you do really matters, then you don't. So you definitely see a huge difference. And people interact better. They go to parties, they find themselves interacting with their friends, meeting people they haven't seen in a while. They're people that avoid friends because they feel like
really?
They
tell you that? Is that what they tell you?
They do.
Really? What are some of the motivations that they tell you why they're going to do something?
Well, sometimes they're triggers. Sometimes it's someone that's been divorced that has to get back into the workforce, and they realize they're competing with a lot of younger looking women, people in sales, people that are turning 50 or turning 60. Those are both big birthdays. People that have had something happen in their life or want a new job. That's important. Their sons getting married, daughters getting married.
Want to look good, okay.
And that's a trigger, but for the most part, we know. I mean, as women, we know when we don't look the way we used to look. And for women, that's really important.
They tell you it's depressing, by the way?
Oh, it's devastating.
Really?
I mean, I can tell you.
Do you think women are more worried about it than men?
It's not fair to say women are more worried about it than men, to me, because women are just terrorized by it. I mean, every magazine we look in, every billboard is of this skinny, beautiful
that's true.
young woman, whether it's in a magazine or if you go in a clothing store. I mean, clothes just weren't made for people that haven't had surgery. I mean, there's no way around it. They just weren't. And we judge ourselves not by what men think or how a man looks at you, whether it's your husband or your boyfriend, or that's so irrelevant to women. And I think that's hard for men. A lot of times there'll be a man in a consult who will tell his wife, you know, you look great to me. I love the way you look. I don't want you to change a thing. And it's hard for them to understand, but it has nothing to do with them. It's all about her, and it's about the way we feel when we look in a mirror, and we're put up to such incredible standards by what we see in magazines, and it's hard.
So with technology and with some of these minimally invasive facelifts in this particular case, do something about it. I mean, is that your message? I mean, if somebody's out there, they don't like the way they look, they don't like the way they're aging, they feel invisible now, 40 plus, do something.
Do something about it. We can do things about it. It doesn't have to be something dramatic. It doesn't have to be out of your price range. There's something to do for everybody, and sometimes it's just a little thing. It doesn't have to be a facelift, a mini facelift. It doesn't have to have anything to do with surgery. Sometimes it's as simple as skincare. I mean, you always have to be a doctor first, and you have to listen to all of it to try to figure out who is a candidate for surgery.
For some people, do you think do they say, like, I got my life back?
They get themselves back.
They get themselves back. They tell you that?
I've had people, right before surgery, when I'm marking them or talking to them and reviewing what we're going to do. Like, okay. I just want to be the me that I remember, and especially with women. I mean, we get pregnant, and gosh, that changes everything. I mean, what a metamorphosis! And you have a child, and that's it. That's all you care about, and that you lose your focus. You don't think about yourself the way you used to, and then. Really, it's like all of a sudden you look in a mirror and you think, where did I go?
So do women just want to be, they want to look pretty?
All women want to be pretty, but not for anybody else. And I think that's the hard part. There's just an incredible amount of pressure we put on ourselves, and we're judged by our clothes. We're not judged by, if we walk into a room, we would much rather women think that we look good than other men. Men are much easier. So we really are about how we feel about ourselves, and at the end of the day, that's what matters.
Very, very good. Very interesting. All of the photos we have here are on your website. Is that right?
They are.
Okay, great. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. Just punch in Dr. Petro. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.